which again, it's my real pleasure to be chairing a group of our scholars, and we have one speaker just before the break, and then we have another 3 speakers after the break. Our first of our scholars is Tanatswa Chikaura. Tanatswa is a PhD student here in Cambridge and a young leader for the Sustainable Development Goals with the UN Youth Office. She recently delivered a speech at the UN Youth Office's press briefing on the newly launched mental health flagship program, and that draws on her own research, which focuses on autism, trauma, and mental health. Before she started her PhD, she'd done an MPhil in Basic and Translational Neuroscience from Cambridge and a BSc Honours in Psychology from the University of Zimbabwe. In addition to her academic work, Tanatswa has founded Nadinwe, a mental health enterprise transforming young mental health in Zimbabwe. Her work in mental health has been recognized through the prestigious Diana Award, which is given to young people for social action or humanitarian efforts in memory of Princess Diana and administered by the charity of the same name. I'm very much looking forward to hearing you, Tanatswa.
Thank you very much. Can I just check if you can hear me? My height is usually a disadvantage, so I always have to move things around. Thank you. Thank you very much for the introduction, and thank you so much for having me here this morning, and thank you to Professor John for that inspiring keynote speech. 8 years ago, my life changed forever. My career trajectory changed forever. I started my first year degree at the University of Zimbabwe, and 2 weeks into the degree, I learned of the deaths of fellow university students. The cause had been suicide. There was no information on suicide prevention. We didn't have any talks. There was no debrief of what had happened. We didn't have any national suicide prevention strategy. We still don't. And it was just silence and business as usual. And that was not okay with me. As it stands, 1 in 7 young people experience a mental health condition. 50% of mental health conditions begin in adolescence, and suicide is the leading cause of death for young people between the ages of 15 and 29. And here's a shocker, 73% of suicides occur in low and middle income countries. Allow me to echo Professor John's words. Youth is pressure on every system. And in the area I work in, it is very clear that governments are not ready to support young people. They don't have the resources, they don't have the strategies, we don't have the tailored support, and that is a problem. It is estimated that Zimbabwe has one of the highest suicide rates in Africa, which is very, very concerning. Now, the current Zimbabwean mental health landscape has improved over the past few years, but we still have a lot of work that we need to do. There's a massive treatment gap. We have about 6 public mental health institutions and 3 forensic services. We don't have enough beds. We don't have enough resources to be able to support people. We have limited professionals. Yes, the system has improved. We have more people graduating as clinical psychologists. We have more people graduating as psychiatrists in training. But with the population of 17 million, we're still very far behind in trying to support people. And funding remains one of the biggest issues. We don't have enough resources going into mental health. Less than 1% of Zimbabwe's healthcare budget goes towards mental health. Now tell me, with that much high rates of suicide happening, is it not shocking that less than 1%, a percent alone, but less than 1% is crazy? And stigma is one of the overall driving factors of that. The people who decide what's being funded, how do they view mental health? The research questions we are asking, how do we prioritize what's important? Is mental health prioritized in the communities? The policymakers, is it an important thing? I mean, if less than 1% is being dedicated towards mental health, yet we've got so much millions of dollars being lost to poor mental health globally, it makes you question what exactly is important for people. So again, allow me to echo Professor John's words. What must Africa know to keep its youth population alive? Allow me to extend that by saying, what must Africa do to keep its youth population alive? If a death is preventable, there's absolutely no reason why we should not be preventing it, investing in preventing it, investing in the research to ensure that we prevent that. I founded Ndinewe, and this is a community-centered approach to youth mental health. We promote good mental health and well-being across Zimbabwe, and we put an emphasis on suicide prevention. And our whole aim is to ensure that the mental health education we're providing is anchored in young Zimbabweans' experiences. Now, funding, I think you'll hear about funding the whole day, is a massive issue. And to be able to scale up your projects as a youth anywhere in the world is close to impossible, especially if you're a founder of something, whether it's a startup, or a nonprofit, whatever it is that you have. To get the resources is just impossible. And I realized that if I wait for some miracle to happen and I get billions of dollars and I become a trillionaire overnight, like some people, or like one person, that it might be impossible to reach all the 17 million people in the country. So I decided to come up with mental health, decided to come up with a suicide prevention framework that has 3 key initiatives that feed into that. And one of the most important things we do is, how do we make mental health education accessible? Young people are not just going to come up and say, oh, tell me about mental health, especially if it's not being prioritized on a national level. And we decided to go into the communities and to use sport as a vehicle to do that. So we have embedded mental health education in youth-related activities. So be it soccer, be it basketball, be it rugby, we go into these communities, we embed our mental health education within that type of setting, and we provide that, we provide the education that way. Another way we have decided to approach young people is by training them to become champions in their own communities. Like I mentioned, I'm not just going to reach 17 million people overnight, but what if we have a champion in every single community that's able to champion their own initiatives? Now, Tanatswa here is not the unique Zimbabwean or the unique African that has an idea in the mental health space. So many young Africans have brilliant ideas. And I know this question was not directed to me, but when Tabitha asked the question about, how do we ensure the young people have the research questions, so many young Africans, at least the ones that I do engage with, they have these questions and they have these great ideas, but they just don't have the platform or the resources or the tools to be able to actually see them through. And that is very true in the mental health space, and again, across the globe. So if we have a program where we train young people to be able to be confident in themselves, to come up with prototypes of different ideas, and we call on governments to invest in these ideas, that can be groundbreaking and it can be transformational. Every community, if one person is training 10 people, those 10 people train another 10 people, and we have a domino effect, it can be incredible. So one of the important things that we believe in is ensuring that we're able to have as many young people with the resources and the tools to empower other people. This course that we created 4.5 years ago has been endorsed by Zimbabwe's health regulatory body, the Allied Health Practitioners Council, and we are able to also train those that support them as well. So in the work that I do, they are high-risk groups, and young men are twice as likely to die by suicide than women, and young men also have poor help-seeking behavior. And over the years, we have seen that young men are disproportionately represented in the programs that we do. So we decided to come up with a campaign to ensure that we're able to reach as many young men as we can. And it's titled the Men Feel Campaign, where we do different programs with young men, we educate them, but we also train young men to be able to champion mental health initiatives in their communities. We also collaborate with different creatives, and the aim of our collaborations is to tell stories, authentic stories of young Zimbabweans, what they are going through. They are graduating, but after graduating, unemployment is high. The pressures are high. They have the responsibilities, and we try to collaborate in telling those stories from their own perspectives. This is a short film that we recently created, and if you are interested in watching it, you can scan the QR code. It's about 6 minutes, and it really depicts mental health from a young Zimbabwean's perspective. Now, where does all of this sit on the international stage, and what has me being a young leader for the SDGs got to do with it? Youth voices and leadership do not exist in a vacuum. We are existing in this space with different leaders. We are trying to convince the leaders, the governments, that please listen to us, this is important. I mean, the high suicide statistics should be enough already, because those are real people. Those numbers are someone's brother, someone's sister, someone's child. They are not just numbers. And in my work, I've had the opportunity to be able to advocate for this on a global stage. I'm able to share the work that the work we see in our communities and the different surveys and the research that I do with young Zimbabweans, and I'm able to bring this in the rooms where leaders are found, where those world leaders are there, and I'm able to say, why are we not prioritizing this? Why are we not localizing mental health education? How best can we do that? And one of the ways that I've been doing that, in the middle there, you will see a flyer for an upcoming event on the 17th of July, where the UN Youth Office will be launching a global youth advocacy campaign, and there will be an event that will be done at the headquarters. And I've been involved in co-creating what that day might look like and bringing the perspectives, not just of me as Tanatswa, but of the people that I work with. And that's one of the ways I'm trying to see my work get into the global mental health space, but also highlight that when we talk about mental health and when we talk about its importance, it is not just a one-size-fits-all. It needs to be prioritized, but also when it becomes a global agenda and we're in those spaces, different member states, including our African governments, are able to see its importance and are able to prioritize that. Thank you very much. I'm grateful to the Ndinewe team that I work with and everyone that supports my work.
Tanatswa, don't go away. I think we have time for just 1 or 2 questions. So, and thank you so much for sharing both the work. And it's so great to see the research that you've been doing being translated into so much effective intervention and action. So let me invite colleagues to ask a couple of quick questions before we break for coffee. So let's take one from there. Hold that thought. I'm going to take one more. Right in the middle here. Right there.
Thank you. That was incredibly inspiring. And I'm an international law professor, so I was just learning from what you were saying. I wanted to ask you if there was one thing that here in Cambridge we could do to support initiatives like yours all over Africa with young people, especially maybe in online education or reaching out partnerships. What would you tell us?
What do you say to the young person in Ghana? What should Cambridge be doing to support?
Thank you. Thank you so much for that question. So I would say, firstly, how is mental health viewed in Ghana? And how is it understood? Because if I'm to give you a definition, it might not suit the context you're coming from, and that's the challenge that we do have on the continent. Mental health has been westernized for a very long time, and it's very difficult to actually break it down in our own local languages. We have recently started going with Utano Wefungwa in Zimbabwe, which is basically mental health translated into Shona. And when we talk to young people, we often ask them, how do you feel? And that's a good starting point, asking them to explain to you what it is they're feeling, because when you hear from their perspective, you're able to tailor what you want to say to them. But just start asking them, how are you feeling about a particular issue? And I would definitely recommend doing that using the local languages, using the local resources, and tailoring them and co-creating those resources with them. I've seen it working back home, and I know that, we're not saying the template works everywhere, but definitely going back to where we come from, our culture, our values, is usually the nice starting point. I'll quickly give an example of how I often describe mental health to young children when I engage with them. I always give this analogy, which, by the way, it does not go deep into how complex mental health is. But I always say, if I break my hand, my right hand, and I'm right-handed, I'm not going to be able to write. I need to go to the doctors to get a cast, to get the support I need, the medication for the pain to go away. It's physical health, right? We all know that. We've been taught about it. Now imagine you're not feeling motivated. You can't do anything. It just feels heavy, and it just feels like something is not in place. There's nothing wrong with then saying, I need help, and I need that support. And yes, I'm equating mental health to physical health, because both are equally important. And then the question about what would I tell Cambridge researchers or people in Cambridge wanting to work with young people in different spaces, I would say involve the young people. Not in a tokenistic way, involve them from the very beginning, from the proposal writing even. When you're creating the project, ask them, what do you want to see? Because the problem is when you come with your initiators or you come with your projects and you want to involve young people at the end of it, we're not going to feel involved. And I keep saying we, but very soon I feel like I won't be saying we for a long but we're not going to feel involved. And that's the scary part, right? When you've been championing youth initiators for majority of your youth and you see yourself leaving the youth, you're like, what's going on? But it co-create the initiators with them, involve them in every process, don't make it tokenistic. And young people are open to collaborating and working with others, but something we're very hesitant of is just being told what to do.